Good morning, ladies and gentlemen. Good morning. Now, this program comes to you from the RAC hospitals that is in the UAE. And this is in fact, the final in the series of diabetes, dealing with diabetes. However, our speaker today is not new to us. He spoke at our previous webinar. He spoke to us in the weight loss webinar, and he spoke about bariatric surgery. Now, I recall during that presentation that he mentioned that almost 90% or more of individuals who underwent bariatric surgery also benefited from remission from diabetes. And therefore, I decided that for this webinar, we would certainly invite our esteemed doctor, but I also thought that it would be appropriate to do some reading in this area. And I discovered that while medical treatment for diabetes results in management, surgical treatment in diabetes results in remission. Further, I read that diabetic surgery is the single most effective way to resolve diabetes. Surgery often results in alleviating the need for diabetes medication, which is chronic and otherwise lifelong. We have invited our speaker today to enlighten us about this vital information and to talk about a new concept of surgery that results in almost complete remission in diabetes. So with that, allow me to introduce our esteemed speaker who is known to many of our participants. Ladies and gentlemen, our speaker today is Dr. Surendra Ugale. He is the Director, Department of Bariatric and Metabolic Surgery at Kirloskar Virinchi Hospital, Hyderabad. He is also a professor of surgery at KLE University, Belgaum, and visiting consultant in Kolkata, Goa, Mumbai, and I'm sure several other locations. His team is the second in the world to start laparoscopic ileal interposition surgery for type 2 diabetes. And he pioneered this in India in 2008, and then went on to train surgeons in Turkey, Georgia, Iran, Mexico, and Russia, and I'm sure in India also. He is a proctor at national and international centers, having 28 publications dealing in his subject of metabolic and bariatric surgery, and has written chapters in several books. He is the associate editor of the Journal of Bariatric Surgery and chairman of the Central Scientific Committee of Obesity and Surgery in India. As a consequence of his work, he is highly awarded. The International Ambassador Award by the Society of American Gastroenterologists and Endoscopic Surgeons, and the Greatest Contribution Award in 2021 for his pioneering work and completing 30 years of laparoscopic surgery in India from the Association of Minimal Access Surgeons of India. And if you are impressed by By that profile, ladies and gentlemen, let me assure you that you will be even more impressed when you meet Dr. Surendra at various functions, as I am fortunate to do. But for now, ladies and gentlemen, I present Dr. Surendra.
Thank you very much for this very flattering and lovely introduction, Professor Adrian. And it's a pleasure to be back in your forum. Uh, I do hope the last session that I participated in was useful enough for all your participants and the people in your region. And I'm glad to be back now to share some insights on the surgical management of diabetes. And before I start my presentation, I would like to compliment you and your whole team and the organization for embarking on such programs, because these are the programs which bring about awareness, which share information, and help the people in society to actually be able to overcome a lot of the health issues, which I think is a very, very important role that uh, teams and organizations uh, like you can do in society. So I think it's a wonderful uh, project you have embarked on so successfully, and I compliment you all for doing that. And I'd like to then start sharing my screen and uh, give some insights on the surgical management of diabetes. Now, when I say diabetes, I am specifically referring to diabetes of the type 2 variety. Type 1 diabetes, as one might know, has a problem with the insulin secreting cells of the pancreas, which are destroyed by the body's own immune system due to wrong signaling. And therefore, people with type 1 diabetes have no cells, no insulin secretion, and they need insulin injections for the rest of their life. And so that group usually in different parts of the world is approximately as a percentage is approximately 5% to in some parts is a little more. But the majority of diabetics have what we call as type 2 diabetes. And you can see from the data available about incidence of diabetes in the UAE and in the Gulf region. These are 2021 figures. This incidence is considered very high when you have a prevalence of diabetes going to 16.4%. There are some other areas like in Mauritius, their figures are at 20%. In many cities in India, the figures range between 10% to 18% in different parts of India. So it's a problem that is increasing in incidence all over the world. And the other factor, I think, that needs to get a lot of attention, and where programs like yours will motivate people to undergo health checks uh, at some regular intervals, because you can see the estimate of undiagnosed diabetes is to the extent of 64%. And in this age group of 20 to 80 years, in the IDF MENA region, you can see 73 million adults have diabetes, estimated to go to 95 million by 2030 and 136 million by 2045. And 27 million are expected to be undiagnosed. In a similar fashion, you can see all over the world, and also in India, where I am based primarily, the rate of diabetes has been increasing exponentially. So let us focus on some of these points as to what would a patient be looking for, what can we provide as from the point of view of healthcare and a healthcare provider, and which patients can really be benefited from any interventions or solutions that we offer. So if you look at what does a diabetic patient really want, they would love to stop insulin injections if they are on insulin, or avoid starting insulin at all. Stop all the multiple medications that they have to take for diabetes and the associated illness of blood pressure, high cholesterol, or triglycerides. Some people, because of their breathing uh, problems and disturbances of sleep, they have to use a machine called a CPAP machine to get better oxygenation at night and to prevent any unexpected heart attacks in the middle of the night. Patients would love to stop or prevent complications like the leg pains, kidney failure with starts with protein leakage from the kidneys, problems with the eye which can lead to blindness, heart attacks, strokes. They would like to have more energy, work much better, remove the lethargy that they experience in life, exhaustion and lethargy, get back a better sex life and a healthier life in general. And now, why do surgeons need to step in to into a field where primarily diabetes has been treated through so many years with medication only? Now, in spite of all the advances that have happened in our medical world, with all the new drugs, all efforts by physicians and by nutritionists to help patients with lifestyle, with the changes, improve their diet, improve their activity by exercise. There's increasing use of sugar-free. There are larger number of fitness centers, and yet we find the increase of diabetes goes on. So in spite of all sorts of treatment, we find an increase in problems in the kidney resulting from diabetes, in heart disease and strokes, in, uh, in loss of eyesight leading to blindness, amputation of their limbs. In Mauritius, where I had made a presentation, I was shocked. They have quite a high incidence of amputations, which leads to loss of man-day working hours and so much of debility in their population. And then there is the mortality, which results from multiple associated ailments which come along with diabetes. Obviously, when treatment is being done, it starts with medical treatment. Now, what we would like to emphasize is that everyone needs to do what is their responsibility first. Do your bit with good nutrition, proper diet, do your bit with being active and exercise, keep the mind as stress-free and develop a positive attitude in life, because stress is one of the bigger problems and which is affecting societies all over the world. So dealing with the mind and learning some techniques, maybe breathing techniques, meditation, anything which can help you to deal with stress, because we all have stress. We all face all sorts of uncertainties in life, in our work, in social life, in family life. So we have to get the right attitude. There has to be an acceptance, and one has to learn to deal with stress. So when ongoing medical treatment is not able to control the HbA1c or the 3-month average and bring the blood sugars under control, if there's a lot of fluctuation of blood sugars, or people who are taking the medication are not having it regularly. Their lifestyles are such, they have to travel, they have irregular working hours. Then there is a lot of fluctuation in blood sugars, which leads to many of the complications. So then one could seriously think of a combined mode of treatment, which is surgical, along with whatever medical help they may need. And this can tackle most of the actual problems and the pathophysiology of type 2 diabetes. It has been seen by all this international data that just giving medical treatment is not able to achieve great success in control of blood sugars or the cholesterol triglycerides or the blood pressures, and therefore the complications. So one can use a middle of the road path by using the advantages of the medical and surgical treatment. And we always appeal to physicians that physicians and surgeons need to be united because the enemy is diabetes and obesity. So please avoid a stubborn attitude or have any blinkers and be open to anything good, anything which is going to help your patient to become well, to resolve their diabetes is a good thing. Whether it's just lifestyle change, whether it is medication, whether it is surgery, if nothing else is able to control them. So why should there be any resistance to anything? As you know, in the earlier years, there's only been open surgery. Then came laparoscopic surgery with its advantages and small incisions and fast recoveries. And then there's even greater advance with even finer instruments, and sometimes only a single incision to take the instruments inside. And it really has brought about a great deal of a cosmetic manner in which we can do these surgeries. So patients, especially ladies, young women who are yet to get married, young males who want to be able to work out in the gym or swim and not feel embarrassed when their abdomen or chest is exposed, they can be assured that there are very nice ways of dealing with the treatments that we have in surgery, and they need not be worried about bad scars or problems and other people knowing about it. This is a great analysis done by one of the great researchers in diabetes, DiFronzo from US, where he shows how there are 8 factors in the pathophysiology. And there are different aspects about how the pancreas initially secretes more and more insulin to deal with uncontrolled sugars. Then the pancreas gets exhausted and the insulin secretion drops. Then there is a role of the liver, which senses how much of glucose is in the blood. Can it remove the glucose from the blood? Can it store the glucose? Can it bring out the glucose into the blood when the sugar level is down? The role of fat cells in the body, and that's why accumulation of a lot of fat becomes adverse to the control of blood sugars. The problem and the role of the gastrointestinal tract. The intestinal system has found to be such a great secretor of so many enzymes and hormones which control so many factors in the body. So when these are affected, again, there can be a problem with sugar control. Then there are the other cells in the pancreas which secrete glucagon, the alpha cells, and if the glucagon secretion goes on increasing, that increases the blood sugars. And glucagon will cause a problem with insulin action. And so that needs to be addressed. Then the role of the kidney, whether it can prevent the reabsorption of glucose, can reduce glucose from the blood as it filters the blood and shed the glucose in the urine. And then the action of insulin and its correlation with all the activities in the brain. So there is a lot that goes on in our body to maintain normal blood sugars. And that's why, as some people like Sadhguru have said, the human mechanism is the most intricate mechanism in the whole universe. And we have to learn to respect our bodies, to be a little more accountable, and to utilize this innate nature of the body to be able to heal itself, provided we give it the right environment. And when one is not able to with one's own efforts, then multiple surgical options are available for those who have diabetes and obesity. So I've just listed out some names which might be interesting to some of you. There are different operations which some are done more commonly all over the world. I know that the sleeve gastrectomy is done the maximum in UAE, followed by surgeries of the mini gastric bypass or the RY, which is known as RUA-Y gastric bypass. These are also done to a certain extent in the Gulf region. And there are many other procedures which are not so common in the world. So these are the different variations in the bypass procedures, because out of all the operations I showed you earlier, in a diabetic who has obesity, bypass procedures can help them with the obesity and the diabetes. And these are the multiple variations that exist in the world. Some have more advantages in efficacy. Some may have a little more malabsorption. So one has to balance what you want to achieve in the patient, make sure there are no side effects, and choose the appropriate operation for a certain patient. Now, when diabetes and obesity coexist, the best treatment can be a bypass laparoscopic surgery. But even better than that is the operation which we focus on also is the ileal interposition procedure. Now, a true metabolic operation, that is when diabetes is the main factor to be addressed, we do not look at the weight of the person. So a true metabolic surgical procedure should be available for a patient who has uncontrolled diabetes or poorly controlled diabetes. It doesn't matter what their BMI is, doesn't matter what their weight is. As you can see from here, from data analyzed and published in the New England Journal, where majority of the people with diabetes in the world have a BMI less than 35, which in the Western world is considered as low BMI and not obesity. So you have 80% of the diabetics in the non-obese group. If you look at Asia specifically, you can go down in body mass index to up to 30. So less than 30, you can see from the figures here that more than 35%, more than 1/3 of the people have lower weight and have diabetes. So this is a very, very significant group. And when you have only diabetes, there's only one surgical treatment available, and that is ileal interposition. This was pioneered by a Brazilian surgeon who is my mentor also. Uh, he introduced this from 2003, and I was fortunate to be trained by. And from 2008, we have been doing the special surgery of diabetes in India. And then we have trained people in India also, besides other parts of the world, wherever the surgeons have been interested. Whenever you have adverse factors of diabetes, you need a stronger procedure. Just a sleeve gastrectomy or many times even a bypass procedure is not going to be enough. So when diabetes duration is longer, if your weight is less, if you are already dependent on insulin, and then there are some some tests we do with a test called C-peptide, and we see what is the level of insulin secretion. Then if there are complications which are starting early, or there's a very strong family history of diabetes and complications, then we need to take really serious notice of this and provide a better and a stronger procedure to deal with this diabetes. There is a system of continuous glucose monitoring, which is like a gadget which can be placed on your arm or it can be on your abdomen. You can do all your normal activities and bathing and sport and everything with this in place. And this gives you a continuous monitoring on your mobile phone, which will help you to understand which food or activity is giving higher blood sugars or lower blood sugars, by which you can adjust your own methods of eating, the choice of food, the choice of activity and exercise. And this can last for 2 weeks. And then if you need to, you can apply another one for the next 2 weeks. But this is a very useful method of monitoring your blood sugar fluctuations. And the greater the fluctuations, the more is the danger to all the organs, like the heart, the kidney, the brain, the liver, and the eyes. So this is very useful to know. Just to give you an idea about safety in these laparoscopic surgeries, when you look at mortality from major surgeries in the world, you see that large intestinal removal surgery has a mortality going up to 10%. Esophageal surgery for cancers, 9%. Pancreas, 8%. Aortic aneurysm, up to 4%. Bypass surgeries, heart bypass, 3.5%, etc. And you can see bariatric surgery or this metabolic surgery of ileal interposition has a very, very low complication rate, because once a person is trained well, their team is good, the equipment used is good, the complication and the mortality rate is as low as this. So this can be done very safely for those in whom it's indicated and who need it. So one can have a subgroup of diabetics who especially can be selected as the main individuals who will benefit for this. So those who have diabetes plus obesity, morbid obesity, or who have diabetes with high cholesterol and triglycerides, some initial heart disease, high blood pressures, those who have protein leakage from the kidney or are showing early signs of retinopathy in the eyes, those who continue to have high glucose fluctuations or sudden drops of blood sugar leading to hypoglycemia, or those who have uncontrolled HbA1c or blood sugars in spite of high doses of drugs and insulin. These are the subgroups we can focus on and give a priority for choosing for these surgical treatments. And the key issues we focus on, obviously, safety first. Everywhere, safety all the time. Then you want a control of the diabetes. So this is called a resolution or remission of diabetes, where you do not need medication and your sugars will be under control. And then beyond control of diabetes, we also look for control of blood pressure, the cholesterol, triglycerides, problems with their sleep, the control of their fat and excess weight, so that the pressure on their knees and the spine is reduced, and removing fat from the liver so that you avoid any liver failures. So these are multiple issues we focus on. And just to give you an idea, a randomized clinical trial was done in Brazil, which showed that ileal interposition procedure is much, much better than any of the bypass procedures, especially because ileal interposition doesn't give you a bypass. So it's a healthier way to USS procedure. These are just multiple steps that we do in the operation. This is all laparoscopic. This is just to give you a brief idea how things are done inside the abdomen. And so we use the small intestine to restore all the failing functions of the insulin and the pancreas without doing a bypass. That is the beauty of the ileal interposition procedure. And we also have to remove a portion of the stomach in that, which is done according to the BMI, according to the weight of the individual. So smaller amount removed for a normal weight, little more for someone obese, and obviously more for the morbidly obese. This is done to reduce the ghrelin hormone so that insulin action becomes even more efficient in these surgeries. This is a publication which came from Italy, which showed that the ileal interposition operation does not lead to malabsorption, which is such a big advantage, especially in lower weight individuals, because they cannot handle malabsorption. Their body cannot handle it. So we have to do it in a way that the person's lifestyle, safety, well-being is maintained, and they can go back to their normal activities and work in a week's time or up to 10 days time. So this can be done in various ways. The first choice obviously is laparoscopic completely, because leads to just 3 to 4 days stay in hospital and rapid return to work, least pain, or some people have no pain. There's a hybrid way of doing it where you can do some part by laparoscopy and some part by open for some surgeons who are getting trained in this. Or you can do completely open in people who are slim and who want a lower cost, as we face in India. And of course, one can do it robotic also. So these are some examples of some of our patients. These were the first two patients who were referred by physicians who were supporting the program. They understood what this surgery can do, and they referred our first two patients in 2008. Then we've had various individuals from different parts of the world. This is an Indian American who was in Chicago. This was just 8 days after surgery, and he was walking around in the city and is looking as good as that. And incidentally, his T-shirt shows and says, "Just do it." The same gentleman, I met him many years later in Dallas while I was traveling there. Now, can you believe it that 9 years after ileal interposition, he has run 11 marathons. He lives in the US. This is as can be. So people need not worry about energy being low or problems with surgery. And you can see there is some types of patients who have a lot of obesity and usually have heart disease, sleep disturbances with that. And when you have the lower BMI, lower weight patients, they have more of ulcers or nerve problems or kidney failures or eyesight issues. So it is harder to deal with the people who are slimmer, but ileal interposition would be effective in these people also. This is a young person who was living his life with a insulin, with a pump which was strapped onto his body. His life was like that for many years until he met us. We had to make sure he has diabetes type 2 and not type 1. And then we operated, and ever since he's been off the insulin pump and living a very active life, and now he is helping people claim insurance in India. This is another gentleman who was taking 20 medicines and 300 units of insulin. And over time, how his weight reduced, his diabetes has gone, and he lives a life free of diabetes and medication completely. Another individual who initially didn't have heavy weight, so he was like just slightly overweight person, leading active life, without his diabetes now, and he's very active in badminton in his part in yeah, northeastern India. Another gentleman who, because of various individuals, had one kidney, various health issues, had one kidney removed in 1994, was diabetic for 15 years, and now had his physician said, we have to preserve your kidney which is existing. So when he began to have small amount of protein leakage, he urgently asked for the surgery because we had to save this kidney and get rid of his diabetes, which we have managed to do. And yet another gentleman, how they get back into active life. These are all their testimonials, and these people are not shy of telling society what they have gone through. Some people want to maintain their privacy, and we respect their privacy. And there are others who want to come out openly and would like to share all their experiences and their journey in this process. So this was in 2013 when we uh, advocated a diabetes scoring system to understand what the severity of diabetes is. And that was very important to know what is the sort of treatment one could choose from. So we had developed from our experience, there were these 7 factors, and later we've added a 8th factor of HbA1c. It was a simple scoring system. So if you have milder diabetes, your lifestyle changes and some medication will help you. When it gets moderate, you may need to consider surgery. When the diabetes is becoming severe, you need to act fast and get surgical treatment to stop diabetes, because nothing else is stopping diabetes, because medication gives you control for the time being. Very few individuals have a control that goes on uh, and is very stable for long periods of time. So those where diabetes is unstable, it is better if they act early, because early intervention is always useful in preventing the complications. And this is to show how surgical factors are able to help so much of the protein leakage, control of blood pressure, control of triglycerides, cholesterol, and the sugar control to a good extent. So this was in 2012 as a publication. And as refinement has gone on, we've also been able to show scientifically how the insulin secretion goes on improving in patients who have been operated. And this is up to a 10-year result from the pioneer, from Dr. DePaula, how the improvement and the control in all groups, normal weight people, overweight people, and obese people, has been improved so well and has brought about so much success. So one needs to adapt to changing needs and tailor the treatment to the requirement. And one also needs to understand that diabetes is not a simple matter of controlling blood sugar. It is as complicated as you can see on the right side, how to understand a woman, part 1 only. Diabetes is very complex, very careful assessment required to do the right thing. So the take-home message I have for all of you is, if you really want to deal with your diabetes effectively, get an assessment of the severity, then get a good physician to choose the right approach for you, whether it is medical or surgical. But you must know that you have an option. If you have uncontrolled diabetes, which is progressing, it can be treated successfully, even in normal weight individuals, by using ileal interposition surgery. With that, I thank you very much for having me here. I have a very short animation video if you are interested in me showing it. Otherwise, I could even end my presentation here.
We'd love you to show the video, Doc, if it's possible.
Okay, so then I'll try to do that right away. Please let me know if this is seen or it is not seen, the video.
No, sir, not yet.
All right. Let me share the screen again, and now is it seen?
Yes,
Yes.
sir.
Okay, great. So here you can see how with certain instruments, we measure the intestinal lengths, and then we use a stapler, and we have to divide parts of the small intestine. And then again, we use measuring instruments. And then we measure the lower part of the small intestine, and we use a segment from there to transplant that, because this has special uh, hormone producing cells which will stimulate the pancreas to make insulin. So there you can see this is the segment of the small intestine which is going to be used, and we measure the full intestinal length, and then we finalize these lengths. So this small intestine segment, from being lower down, is brought up closer to the food, brought up there. You can see it getting joint on the top, and then the rest of the intestinal system is joined. So there is no bypass of intestines. And for the stomach part, depending on the weight of the person, this is how a portion of the stomach is removed by the staplers. And so this, for those who have excess weight, will control their weight also. Plus it helps in, as I mentioned earlier, better insulin secretion when the resistance from the hunger hormone or ghrelin is reduced. And so in combination, this makes a very successful ileal interposition procedure, which improves insulin secretion when the body needs it. It reduces the glucagon so that the whole control of sugar becomes more efficient. So, yeah, so just wanted to show that short video, and I'll end my presentation here, and I'm fine to take any questions that you may have.
Yes, but before that, Doc, that was profound, informative, convincing, brilliant, and I can carry on. You know, I understood exactly how complicated your subject was when you presented perhaps one of the last slides about the inability of us to understand a woman, which was only part one. If that is how complicated it is, then it is truly complicated. But when I said convincing, I have to tell you that your patients who did the marathon, 11 marathons. Now, we need to understand that the marathon as a race is the limit of human endurance.
That's
continuous aerobic human endurance. To be able to run for 2 hours, 45 minutes, or 3 hours, or whatever the time you take, is the ultimate endurance that a human can possibly take. And for your patient to run 11 marathons after your surgery, you can have no better certification to the great success. And then the insulin pump. I mean, the quality of life improvement that you brought about over there. And then a month from now, we are going to start our weight loss challenge. And here you are telling us about an individual who, through your surgery, dropped from 163 kgs to 85 kgs. Now, it obviously means I was paying a lot of attention to your entire presentation. And I can tell you And you will be able to judge that my attention was rapt by the fact that on your scale, my score is 6. Now, I don't know whether that's good or bad, but on my, I will talk to you about that sometime. But I actually went through that table of yours and I'd scored 6. It can get worse, but with your help, I'm sure it will be better. The video, you can't possibly have a presentation without that video, Doc. It was fabulous. I mean, it removed it, it is so difficult by words to understand exactly what this surgery takes. But that video indicated the brilliance of that surgery. Thank you ever so much. And I know the audience is very irritated with me for taking the time that I normally take. I hand over now to Dr. Wilku. Sir, questions?
Thank you very much for all your appreciation and all your words. Really, thanks so much. Thank you.
Thank you, Dr. Ugale, for a wonderful presentation. Like Professor mentioned, it was very nice. All pathophysiology behind the scene you have mentioned, and especially the last animated video. Many people may not be understanding what exactly you were talking, but when you showed the animation, many things are clear now. So I have started taking questions. I am receiving on WhatsApp also, but I'll take from chat box first. Hassan is asking, because this is a very common question, people are very confused about it. Is surgical management effective for diabetes? And also he has a corrected question. Also, how does bariatric surgery help the diabetes?
Okay. So now, as far as the efficacy goes, surgery is very effective. We have enough of data from all over the world over the last more than 30 years now, especially the last 15, 20 years, tremendous amount of data proving this. Now, how does bariatric surgery help in this? For those who have obesity, that's morbid obesity along with diabetes, then the bariatric surgery is primarily aimed at weight loss. When you have the weight loss, you are going to have a better efficiency of insulin action. The insulin resistance because of the fat cells is reduced and gone, so that becomes more efficient. And bariatric surgeries, especially when you do the bypass surgeries, are even more effective also in controlling the triglycerides, the cholesterol. So it's all these multiple actions that it does along with its control of sugar, because the requirement of insulin drops. Your pancreas is able to secrete it better, because the bariatric surgery, when you do the bypass, in the ileal interposition surgery, you saw how we took the ileal segment from right down, we took it high up into the tract to get stimulated by food. In bariatric surgery, you bypass some part of the initial intestine and take the food down to the lower intestine. So you see, it's trying to achieve a similar action. The only problem is there is a bypass also with it. So as long as you don't do excessive bypass causing side effects or malabsorption, this bariatric bypass surgery will be very effective also.
Thank you. The second question is, I think, interlinked with the first question also. Bharat is asking, what is the difference between bariatric surgery and diabetes surgery? Are these different procedures? You have already answered this. So, yesterday there was one gentleman who was asking about when he saw the webinar on diabetic surgery. He was wondering that whether the organ which is producing insulin is replaced, like a transplant. So I told him just have a patience, and then the surgeon will be talking about it. And you have wonderfully just mentioned ideal repositioning. That is how it works. So even when he was having a lot of questions, he was asking, are the cells being planted on the pancreas to produce more insulin? How it works? So like you mentioned, all the procedures you have already mentioned. So is it a chance, there is a chance of remission, the diabetes may come back or it will remain controlled?
So now this depends on how early it has been treated. For example, if the pancreatic cells have been damaged over a long period of time, then the diabetes may remain resolved for 5 years or 10 years and may come back after that. Or some people may need some small amount of medication. But if one has been treated before this extensive damage of the cells, then you'll be free of diabetes lifelong. And just like to add to what all you said earlier. Firstly, bariatric surgery and diabetes surgery, or diabetes, as we call it, metabolic surgery also. Bariatric surgery was created for weight loss. And then sugar control and other things which were controlled were the fringe benefits that came with it. Now, bariatric surgery cannot be done in a person with diabetes who has normal weight. You cannot do bariatric surgery unless you have morbid obesity. So automatically it can be done only if there's morbid obesity coexisting. So you get that group only. When you have lower weight, normal weight, slim people with diabetes, only ileal interposition or diabetes surgery, one wants to call it, is possible. Then the question about whether pancreas gets replaced. Pancreatic transplantation is being done in the world, but for very severe, especially type 1 diabetics who have kidney and pancreas failure, and mortality is still quite a bit. So pancreatic transplantation is not yet completely in place for regular usage, like we have kidney transplant or liver transplant and even heart transplant. So we still have to get there. In the meanwhile, the small cells of the pancreas, islet cell transplantation, is being done in few parts of the world again. It is successful to a small extent, and in some people, not in all people. It is like the stem cells effect. Works in some people to some extent, in other people, sometimes there's no effect. So we don't have everything in place for this islet cell transplant or stem cells or the pancreas transplant. And as Professor Adrian mentioned earlier about the person who ran the marathons, what better advocate can we have? I'd like to add one more advocate on my personal front. My own wife has been operated 11 years ago. She's a gynecologist. She's free of diabetes. And if the procedure was not good, I'd have to face a lot of flack every day of my life.
True.
She's one of the great
So it
ambassadors.
certifies the surgery.
Certifies the surgery.
Sure. Sir, there is one another question which you just answered, but I will just take it. The combination of bariatric surgery along with the ideal repositioning. Mr. Joseph is saying, my mother is grossly obese. Her BMI is 42. And she is suffering from diabetes for last 12 years, and which is not very well controlled. What do you suggest for her?
Okay. If I'm not sure what her age is. Did he mention the age?
Yeah, 43.
Her age is 43. BMI is
Age is 42. BMI is 42. Age is 43.
I see. So if she's that, she's likely to be fit, and she can. The best procedure will be ileal interposition. Second best will be a bariatric, bypass procedure. Also, she can even undergo that. Now, so depending on fitness, we also will choose, because the ileal interposition procedure is little longer than the bariatric bypass surgery procedure. So as long as we have anesthesia, fitness, and security, we will do the ileal interposition. If we find that there are some negative factors, then we will do a shorter procedure like the bypass bariatric surgery. But both can help her.
Yeah. Just now he asked about the same continuation of that question. After surgery, will the medication stop because she is taking a lot of medications?
Yes, so the certainty is that after ileal interposition, all the medication will stop. In most patients after bypass bariatric, also all the medication will stop. And now, depending on her pancreatic factors, will will lie the answer whether any medication may come back later or not. So before surgery, we do some blood tests to check the pancreatic response. If the pancreatic response is good, then even after the bypass surgery, all medication will stop and stay stopped. If the pancreatic response is poorer, then ileal interposition surgery is the better surgery to help her for a prolonged diabetes-free life.
Thank you, Doc. So there are many questions, but all are covered under your presentation. So I will take one question, that is the last question, which generally we come across. If you remember, I have asked this question earlier also in the weight loss challenge webinar. One gentleman has asked, he said many people, I have heard from many people that bariatric surgery, after bariatric surgery, there is a regain of weight. You again gain weight and again you have to struggle with the overweight. So is it true?
So I showed you a variety of procedures that exist in the world. If we do not choose the right procedure for the right individual, then you will have all these issues. Because when we encounter a patient, we take the detailed medical history, we are seeing what their daily habits are, what their exercise habits, what their dietary habits. Do they have a craving for sugars and sweets? Have they got a strong family history of diabetes or not? If if any of these factors are there, then obviously you need to choose a procedure which will help them in their individual circumstances. Now, if you choose a simple procedure like a sleeve gastrectomy, all over the world, about 50 to 60% of the people are likely to regain weight, is the international data that is available. So a person with a sleeve gastrectomy, which is a simpler procedure, needs to put in greater effort at exercise, control of stress, control of diet. If you have a bypass procedure done, you because the intestinal hormones get activated, which are stronger, you are more likely to maintain that weight with a bypass surgery. Unless one is very indisciplined and then just starts taking very high calorie liquids of foods, especially liquid, which is high calorie, can go down into the system very rapidly. So if one, now for example, we sometimes get a patient of polio. He cannot exercise, he cannot walk. If you do the simplest procedure, then you are more likely to face weight regain in individuals like this. So that's why choosing the appropriate procedure is extremely important. Then you will not get these issues of weight regain.
Thanks, Doc. There is one interesting question. Dr. Veena is asking, is there any side effect of hypoglycemia after the surgery?
Okay, if you have hypoglycemia, which is more likely to occur with the bypass procedures, because there's a rapid stimulation where the initial food goes down into the lower intestine very rapidly because there's no valve or control. Then you can get hypoglycemia. One can have a lot of giddiness. You may fall down anywhere you are, in a marketplace or in a mall or wherever. You may have some convulsions if you get very low sugars for a little more prolonged, time. So those are the issues with a hypoglycemia, and one might hurt oneself. So people who experience this are first of all advised to have complex food items, so that it's not a carbohydrate rich diet. That's very important to prevent a dumping syndrome or sudden hypoglycemia. So if there's mixed food, slow release of glucose, this is not likely to happen. With ileal interposition, because the insulin response is appropriate to the food stimulus, you do not get issues of hypoglycemia. So yes, that's something to watch out for, especially in the bariatric bypass.
Thank you so much. I think we have covered almost every questions. Let me check. Yes, sir. From my side, it's over. All the questions have been covered differently. Professor, over to you.
Thank you once more, Dr. Surendra. God bless you, sir.
So your voice is muted. So you are muted.
Okay, can you hear me now? Yes? Okay.
Yes,
It
sir.
only gives me an opportunity to thank Dr. Surendra once more for that brilliant talk, informative. I've learned about the continuous glucose monitoring system. So that is something that RAC Hospital is going to be looking at. I'm not sure whether my colleagues were active in that area, but certainly I will promote that. But I'd like to thank Dr. Surendra once more and to request him to support us once more 1 month down the road when we start our weight loss challenge. Now, we keep the best for last, and therefore, last year in 2021-22, when we did our weight loss challenge, the last topic of our seminar was bariatric surgery, which Dr. Surendra did. So we will be connecting with Dr. Surendra again and requesting him to set a little time aside for us. Thank you so much, Dr. Surendra. God bless you, sir. Dr. Wilco, I'd like to thank you very much for the questions and for putting this webinar together. Thank you so much. Our audience, you couldn't take away better information than you have today and over the last many webinars that we had. So I'm wondering whether I should thank you or you should thank me. But for reasons of tradition and proprietary, I will go with thanking you at this point of time. This webinar would not have been possible if it was not for RAC Hospital, if it was not for my colleague Sade, who's sitting on the back end, and Saloni, who's recording everything we do, and the IT department and the admin department and all the other departments, except of course the finance department, because Dr. Surendra has been very kind not to accept any fee at all for this, and we are grateful for that. Okay, and now that brings us to our concluding slide, which is the slide that informs all our listeners that the RAC Diabetes Challenge, which started in September of this year, it started on the 14th of September, and we've been through 3 months of information being provided to our clients about how to manage their diabetes. We end on the 17th and 18th with the HbA1c weight and lifestyle testing. And then we have the award ceremony on the 20th. We look forward to all of you. Thank you very much, gentlemen, Dr. Surendra, Dr. Wilku, and everyone, my audience. Thank you so much and have a great day. Thank you and goodbye.